say, tell me more.
Sorry, I had to unmute myself. Okay. You can say that, like if that, for how long you've been having the pain, so you can say, yeah, I have the pain worse for the past 24 hours, and that has some, you can just say like something like that, like the time of the pain.
Okay. Maybe it started yesterday and it's gotten worse?
Yes.
Okay. So my stomach has been hurting. If they say, tell me more, say, the last 3 or 4 hours it's gotten worse. So our main concern is the pain. We haven't had a fever, but we did have chills last night. When the pain began, it was a 4 out of 10, and that was 24 hours ago. But it's gradually gotten worse, and it's now an 8 out of 10. When the pain first started, it was vague, dull, and it was difficult to really pinpoint where it was, but it seemed worse around the navel area. And it changed over the last 24 hours, and now it's sharp with an intensity of 8 out of 10, and it woke you up at 5 a.m. this morning. It's not relieved with any other position. It's better when you're just lying still. We took Tylenol, but we're not any better. We have some slight nausea. We vomited once this morning when we awoke at 5 a.m. We don't feel like eating. We have no appetite. We've had some slight spotting, which began 2 days ago, and our breasts are slightly sore. Our first period was when we were 12, and our last period was 6 weeks ago. So, doctor, would it be okay to say if they want a little more specific, say like Easter weekend? I went back, and that was around the time.
Okay, yes, that sounds good. Yeah.
Okay. Normally our periods have been very regular, 28 to 30-day intervals, and they last 5 days. We've had one prior pregnancy. We had an elective abortion when we were 19. There was no complications. Sometimes we forget abortion, ENC, is a surgery. We don't have any medical problems. We did have another surgery besides the abortion when we were 18. We were stabbed in a robbery. Our bowel was injured and we had surgery to repair it. Everything healed as well as far as we know. Our social history is we lived with 2 female roommates. We used condoms for birth control and Plan B. We've used that 3 times in the last year. We're a hostess at a local restaurant. We're sexually active with our boyfriend that we've had for 4 months. We've smoked 3 to 20, a few to a pack per day, cigarettes a day for 10 years. So we started smoking when we were 12. Is that correct, doctor?
Yes.
Okay. We've used a variety of drugs between the ages of 15 and 20, mostly marijuana, but we did experiment with cocaine a few times. Currently, we occasionally use marijuana. So how often should we say we smoke the marijuana?
You can say a couple of times a week, like 2 to 3 times a week.
Okay. Both of our parents are alive. We have 2 older sisters. We were treated for chlamydia 3 years ago. If they ask us how it was treated, what should we say?
They say antibiotics. It's asymptomatic, but I don't know if that will necessarily to be say the exact antibiotics, because most patients are not going to remember the exact antibiotics from 3 years ago. You can just say some pills.
Okay. Everybody got that? Our first intercourse was at 18, and we've had 6 lifetime sexual partners, all males. And we have been monogamous for the past 4 months with our new boyfriend. Family medical history, our family is healthy. The only health problem that we know about is that our mother had kidney stones. You note occasional bloating of your abdomen ever since your bowel surgery. So is this like after eating, or is there any particular thing that we do that we notice the bloating?
No, you can say that just like it's not like necessarily related to food, because it's like that's just for one of the differential diagnosis could be irritable bowel syndrome, which normally like sometimes is just not necessarily related to food or anything like that. So you can just say occasionally, but I haven't noticed any relation to food or.
Okay.
You can maybe say if they keep like asking, you can say maybe I have noticed that it's like more noticeable like around before the days before the period and during their period.
Oh, okay. Right before and during.
Not like around when they have periods.
Okay. Okay, so the bloating we notice mostly before and during our period. Our bowel movements have been normal for us. You always have some intermittent diarrhea. So is this intermittent like a few times a week, once a day?
No, you can say a couple times a month.
Okay.
Mm-hmm.
Okay. We haven't had any constipation. We haven't had any blood in the stool or any black stools. Our urine looks darker than usual, but we're not sure why. You don't really know if this is blood or not. So has this just happened over the past 24 hours or longer?
Yes, no, since the pain.
Okay, since the pain. Our urine looks darker.
Yes, 24 hours. Mm-hmm.
So we don't have any burning when we urinate or change in frequency. We have noticed some spotting of blood from our vagina for the past few days. And we've noticed a thin gray vaginal discharge over the past few weeks. It does not smell. You haven't had any other problems. You haven't had any pain with intercourse, but you haven't had intercourse since the pain began 24 hours ago. So the skin may examine your chest, listen to your heart and lungs, and they may look in your eyes, ears, etc. Does anybody have any questions that we haven't covered for the history before we go into the physical exam findings?
I have a few questions. So the location, I know when we first had the pain, it was kind of diffused and dull, but today it's sharp. Is there a very specific location for that, or it's still like just everywhere?
No, you can say, we mentioned before, more like kind of like around the umbilicus and like kind of like on the lower area.
So today we're having the pain around the belly button and also the right lower quadrant, we'll say?
Yeah, kind of like on that area, yeah. Mm-hmm.
Okay, and it's a sharp pain in both areas?
Yeah.
Okay, and also is the nausea constant?
Yes, since the last
yesterday?
Mm-hmm.
Okay, and the onset, it was just sudden?
Yeah, you can say, the past 24 hours you start noticing, and it's been getting worse and worse, and in the past couple of months.
Okay, great. And last, the appetite, also the same, 24 hours.
Mm-hmm. Like it can be like it has been, just the start like mild and it's progressive and getting worse.
Okay, great. Thank you.
I have a question, please.
Yes.
In the past medical history, when we're talking about the stabbing and the robbery, if they ask like, how were we involved in a robbery? Would that be like maybe at the restaurant we were working at, or?
I mean, yeah, you can say, that you'll be in the restaurant, or in the street, or you can say probably it would be more like, it will just happen on, you know, you were robbed while walking on the city.
Anybody else? Okay, for the physical exam findings, the students are expected to perform an abdominal exam, including inspection. They should look at it before they start to palpate. Then they should auscultate, which is listen for bowel sounds. They should palpate. They should press in all four quadrants as well as the epigastrium and the suprapubic region. So there would be 6 places they should palpate. Everyone's familiar with the other 2, correct? You're tender whenever they press on your abdomen in the right lower quadrant of your abdomen. It'll be tender with both light and deep palpation, but when they palpate deeply, you really can almost not bear the pain. So how should we, if they say I'm pressing deeply now, your right lower quadrant, what kind of reaction do you want us to have, doctor?
Kind of like, well, I don't know what it has like the but like, you know, kind of like you kind of like scream a little bit or something like that, like "ay," or and like kind of like bend over, like when they press, like, you know, bend over, like.
Well, they won't see us on the bed because we're doing it over the phone. Should we just say, like, that really hurts? And maybe...
Okay. So you guys, that was my question. You guys are not doing, like, video? It's just phone?
Yeah, they can see us.
Yeah, it'll be video.
Okay. So yeah, you can kind of just bend over. If you're like sitting, you can just like kind of like make a noise and like bend over a little bit.
Okay.
Yeah, because the student will pretend to do the abdominal exam. If they're pressing the abdominal exam, and then that's when you think it hurts or something.
Yeah. So you can say exactly. You can say like, oh, you know, that really, really hurts, and like kind of like bend over.
Okay. So when they do it lightly, just say, oh, it's kind of tender right there. And then once they do it deeply in the right lower quadrant, that's when you really have a reaction to it.
Yes, correct.
Okay. You will be tender if they press over McBurney's point. This is the spot between the brim of your pelvis and your navel, your umbilicus. Does everybody remember that? Is that the one for the appendix?
Yes, kind of. So that's like the right lower quadrant area, yes.
Okay. Has everyone done the case for the appendix where when they press into that one spot, it really hurts? And then if they press, you won't be tender in any other areas of your abdomen except for the right lower quadrant, and if they do McBurney's. Then if they press in over your abdomen and let it go, it will hurt when they let go more than when they press in. So is that any location, doctor, when they press in and let go? Or does it have to be in the right lower quadrant?
Well, it should be in the right lower quadrant, but I don't know if they will, so they may just say, oh, you know, I'm pressing and I'm releasing, and you can say that hurts more. Because I don't know if they're going to like specifically they're not going to do that in every quadrant necessarily.
Right.
So if they just do, you know, like I'm pressing and letting go, just tell them that it hurts more when you let it go. So they're not going to do that in every quadrant.
Okay. Okay.
They're going to try to do that like just once.
Right.
Yeah.
But sometimes I've had them like press in on the left side and let go and say, did that hurt?
Yeah, that's okay. Really, it's just for
yeah, it hurts when you release. Okay.
Yeah, that's fine.
And then And then if they jostle the bed or shake our abdomen, if they say something like, I'm jostling the bed now, or I bumped into the bed, we're going to say that hurt. That was uncomfortable.
Yeah.
Then if they say they lift our right leg, it will also increase the pain in the right lower quadrant. So all the pain is going to be localized in the right lower quadrant.
Yes, correct.
And then they should tell us that they're going to do a pelvic exam. Of course, they won't do it, but they should mention that. So then I have a question. I don't know if Doctor can answer this or Hector or Data. So the special instructions are we'll be in a gown and we'll need makeup to simulate a scar. Are we going to or just tell them we have a scar?
Yeah, you can just tell them because this is not
right.
If they ask, you just tell them.
I guess when they're doing the inspection, because they're supposed to look, right, we could tell them that there's a scar from the surgery.
Yes.
Mm-hmm. Okay, good. So just pay attention to that location of the scars so that you can let them know that's what they would be seeing.
For the pelvic exam, they may just put it on the plan, so that would be okay too.
Okay. Does anybody have any questions about the physical exam?
I have one question.
Yes.
How big is the scar?
You can say about, how much is this? About 5 centimeters.
Okay, thank you.
Oh, was that, I'm sorry, 5 centimeters?
Yes.
Okay, ready for the checklist, the 10 questions. So number 1 is they're going to elicit the past surgical history. So my question is, Doctor, do we just mention the bowel surgery, or do we say, and I also had an abortion?
Yeah, both.
Both? Okay. And then they're gonna elicit the pregnancy risk, ask us what kind of contraceptives we use, and could we be pregnant, or what kind of birth control do we use? They can ask any of those to get the point. They're going to elicit the past sexual history. So that would be how many partners we've had, or when was our first sexual intercourse.
Mm-hmm.
They're going to obtain the first day of our last menstrual period. So that's why I was saying, could we say it was like Easter weekend?
Yes.
Okay.
I'm sorry, I have a quick question. I'm curious. So it's been regular, but just one time it was 6 weeks ago?
Yes.
Okay, thank you.
They're going to elicit associated symptoms. For example, they're going to ask if we have nausea, vomiting, if we have loss of appetite, chills, vaginal spotting, any of those. They have to ask at least 3. 3 of those to get the point. They're going to examine the heart in 4 places on the skin and the lungs in 6 places on the back. So when we first started doing these cases, I asked Dr. Francis about that on the skin, and she said that for right now we can kind of remind them by saying, when they say, okay, I'm going to listen to your heart in 4 places, you can prompt them and say, do you want me to remove my arm, or do I need to lift my gown, to encourage them to start saying that it's on the skin. So if you can remember to do that, or if you don't think they're running out of time, that's a good thing to do. Just throw it in there that you want to know if they're doing it on the skin. But either way, she said go ahead and give them the point, but just give them a reminder.
Yeah. Yeah, because they may know, since this is kind of they may just think about where they're going to do it, but not necessarily,
Right.
Yeah.
Right.
Yeah, that's fine. If you just mention it, you can get the point.
Okay. So then they should perform an abdominal exam. They should listen for the bowel sounds, and then they should palpate in all four quadrants, and then the other two locations, the epigastrium and the suprapubic. And then they should check for tenderness at McBurney's point. Remember, that's where your appendix would be. So, doctor, should they specifically say, now I'm checking either for your appendix or McBurney's point? Should they let us know that it's just not the right lower quadrant? They're also checking for that specific thing?
Yeah, I mean, I actually think that even if they just say right lower quadrant, you can get the point. Because, you know, like, sometimes you don't expect the patients to know what my burning point is, or what, so they may just kind of like think about where they're doing it, and not necessarily like, so if, like if they specifically say, oh, like, I'm 4 quadrants, and then if they mention, oh, now I'm going to like check more specifically in this point in the right lower quadrant, or if they mention my burning point, or I'm going to check for the appendix, any of those things will be okay.
Okay, so they have to do the right lower quadrant in extra time, in other words.
Basically, exactly.
Okay.
Or make emphasis on that part, or something like that.
Okay. And everybody has probably done the communication checklist. Is there anybody that hasn't been doing that one? Do you have any questions on any of those? The 1 through 20?
I have a quick question. So when it says patient education or suggestions, I pretty much give them credit if they like explain anything to me, or I mean, it's not necessarily like a quitting smoking type of thing, but is that okay?
Yes, basically, if they go over like the plan that they want to do, or if they kind of say, oh, I think you have, maybe I'm going to check because you can have appendicitis, or maybe can you have an ectopic, and if they explain some, kind of like what their thoughts and about the diagnosis, and or if they explain like the plan that they, planning to do, any of those lines, you can give them credit.
Okay, sounds good. Thank you.
Yeah, I do the same thing, so yeah. Yeah, as long as they explain what they find or what they're,
Or the follow-up that they want to do with you, or anything like that. Yeah.
I have a question, Ms. Ingrid.
Yes.
On the 10 item checklist, on number 5, I've always had a little bit of questioning when it asks, when it says at least, that they must do at least. So if, let's say, they only do 2, do you mark it no and then say that they only did 2, or do you mark it yes and say they only did 2?
Yes, minimum of 3, because, technically they should do way more than 3.
So we mark it no.
So yeah, but if they only ask 2 things, because if they only ask 2 things, they don't have enough information to know the differential diagnosis.
Okay, thank you.
Yeah, it always has to be, if it says at least, you have to give them a no if they do less than the at least number.
Just kind of like put in the comments that they only put 2.
Any other questions for the doctor?
No, not
I just wanted to clarify. So in the beginning, when we say my stomach has been hurting, it all started 24 hours ago?
Yes, and it has progressively getting worse.
Okay, thank you.
You can say, first I started noticing like a day ago, I started with like a little bit of pain, and it has been getting worse and worse in the last couple of hours. It's just been like very bad.
Our elaborating statement was the last 3 or 4 hours it's gotten worse.
Yes.
Yes.
And yeah.
Hector or Data, do you have anything you want to add or tell us?
No, nothing. We will start early Tuesday. We have not received the schedule for the students yet, but you guys are all set. We'll send you all the links, probably late Monday or over the weekend, depending on when we get them, or maybe later today, hopefully. Just keep an eye on that. We all noticed we are now going to personal rooms, so the WebEx link is not as long as it used to be, or it looks like it used to be. It's a lot easier to determine who's going where, because it does have the coordinator's U-Rater name and or last name on them, so they're a lot easier to identify. Other than that, pretty well. The connections are pretty good. Just understand in regards to where you are located in your room, in your house, make sure you have a good connection. Please log in when we ask you to log in, and make sure you talk to the coordinators when you log in. Make sure you can hear them and they can hear you. Because sometimes they tell us that they're ready to start, and then all of a sudden, they either can't hear you or you can't hear them. So just to confirm.
Anything else, anybody?
Anything else, Data?
No, did you guys have any questions on the checklist?
No, and you said we'll be able to hear this whole training on YouTube or something. How do we access that as well?
After we post it, we'll send you all a link to the YouTube channel so where you can again if you want to review anything. Also, from here until Monday, if anything comes up and y'all can't make it, please let us know. Regardless, send us an email, call us, smoke signals, pigeons, anything. Things happen, so please be aware that we are expected for you to be there. But if something does come up,
On the physical exam or on your scar, is there? Yes.
is there any information you would like to tell the students that's not doing properly or incorrectly, or if they're confused in any way?
Just when it comes down to the actual, when they're checking, the heart or the lungs, just to be more to verbalize it more. There's some that, do really well, and there's some that, they just kind of say, I'm just going to check your heart. Just that, I guess.
Okay, we'll let them know again.
Go more into detail.
In more detail, but in layman's terms.
Yes. Because some will even do it on themselves, I'm going to check you here on this side, and so on. But that's kind of that.
Okay, thank you. We'll let them know.
Most of them, Hector, are really good about asking if they can do this interview because it's on the checklist. But a few of them, they don't ask permission. So it's on every single checklist. Like I said, most of them are pretty good about it, but there's a few that just start in with the encounter.
Okay. And as a reminder for those of you who weren't here recently, only the SAT or UNC learning space to do the checklist. The students will be presented with the presenting case, so they should already know your name and everything and what the situation is before going into the room. They will not say, please let me review your chart. That was only for the OSCE and the box. Because we just felt that that was taking too much time. So Eric is presenting them with the presenting case, along the situation, and then we have them proceed to the room. But they should still be asking permission to actually do the encounter, like you said.
Do we still have to change our name when we log in though?
It would help if you did. Just,
Okay.
if you can't, don't worry about it. I mean, they're aware of that as well. Especially if it still has the end of your OSCE name on there. Any other questions? Okay, ladies. Dr. Hernandez, thank you for attending as well.
Thanks.